Do you know who performed the world's first spinal fusion? Dr. Russell Hibbs was a Kentucky-born orthopedic surgeon whose work helped shape early spine surgery. He attended Vanderbilt University and graduated from the University of Louisville School of Medicine in 1890. In 1894, he took an appointment as a resident surgeon at the New York Orthopedic Dispensary and Hospital, and after only 6 years was appointed surgeon-in-chief of the New York Orthopedic Hospital. At this time, orthopedists were brace makers first and surgeons second, but Dr. Hibbs was a pioneer in the use of arthrodesis for the management of appendicular tubercular osteomyelitis, which was one of the rarer musculoskeletal manifestations of tuberculosis. In 1909, he developed a technique for knee arthrodesis, emphasizing the importance of bridging bone grafts and meticulous preservation of periosteum to support new bone formation. And these principles, structural bone grafting and biological support for fusion, would soon be applied to the spine. In 1911, Dr. Hibbs performed the first human spinal fusion operation at the New York Orthopedic Dispensary and Hospital, which is now part of New York Presbyterian Columbia. The patient was a 9-year-old boy with lumbar Pott's disease, and Dr. Hibbs performed a T12 to L3 posterior spinal fusion. His technique involved removing the spinous processes and transposing them as an autologous bone graft across the defect, supported by the preserved periosteum. Hibbs refined his approach over time, later expanding procedures to include the interlaminar spaces and eventually the facet joints, broadening the surface area available for fusion and improving stability. By 1914, he was using posterior spinal fusion techniques routinely to treat scoliosis, including torsional deformities resulting from tuberculosis. Postoperatively, patients were immobilized, either through bed traction or corsets for several weeks to promote solid fusion, which reflected the constraints and strategies of early 20th century spine care. Dr. Hibbs' contributions were not limited to surgical procedures either. They also extended to the instruments that made these procedures possible. The Hibbs retractor is a handheld surgical retractor used primarily in orthopedic and spine surgery. It is commonly used for manual retraction of paraspinal muscles to expose the facet joints and lateral recesses, exactly the anatomical corridors required for posterior spinal fusion. And since its design was specifically suited for interlaminar exposure, it became the predominant retractor in the early days of spinal fusion. Dr. Hibbs' contributions helped transform spinal surgery from largely external mechanical support to internal stabilization and fusion, and laid the foundation for modern spine surgery. So the next time you grab a Hibbs retractor or assist in a spinal fusion, you can thank Dr. Russell Hibbs for his contribution to our practice.